Well, okay, perfect. Well, here we are. We've hit noon, and I'd like to welcome you all. Really excited to have you join us about this exciting conversation. That's of course very timely. Would like to just let you all know that we've got a wonderful community of people. We're very close to 100 people who have tuned in and are listening to the conversation today. I think we've got 99 is what Jillian is telling me right now, so that we have space for one more person who wants to join in. They certainly can, because we do cap it at 100. So we're very excited to have everybody here. And just to do a quick conversation or a quick introduction, my name is Vera Asanen. I'm President and Editor-in-Chief at Your Workplace. And my role today is as the moderator of this conversation about the legalization of cannabis and the impact on the workplace. So welcome to you all. And Sarah, how about we start? How about a quick introduction as to who you are?
Hi, so my name is Sarah. I'm a clinical pharmacist. I work at Personalized Prescribing, which is a pharmacogenetic testing company that looks at a patient's genes to try to tailor their medications to find ones that are more likely to be effective with the least risk of side effects. We work with employees for employees who have this benefit covered for them, but we also work with disability managers and disability management companies for patients who are on disability to help them be more productive in the workplace, and also to accelerate their return to work by helping them with the medication aspect of their treatment regimen.
Great, thank you, Sarah, and welcome. Jason.
Hi, I'm Jason. I'm the VP of HR for MedRelief, which is one of Canada's largest producers of medical cannabis. And so I run our HR programming here, and also do a lot of work to educate employers on adding cannabis to benefits plans, and also how to just manage cannabis from a risk standpoint in the organization, both from a medical cannabis and a recreational cannabis perspective.
Perfect. Well, thank you and welcome, Jason. Paula, thank you so much for joining us. Would you like to just introduce yourself as well?
Absolutely, and it's my pleasure to join. So Paula Allen. I'm Vice President of Research, Analytics, and Integrative Solutions at Morneau Shepell. And our organization really supports the health and productivity of employees through support to them directly, as well as workplaces. So this issue touches us in a number of different ways, from an employee health point of view, from a disability and accommodation point of view, from a policy and practices point of view. So very happy to be part of the panel.
That's wonderful. Well, thank you. And we also have with us Jillian, is our producer today. And so Jillian will be managing a few things. One is that we are going to be live on Facebook right now. So that's being a live stream, and she's managing that to our community on Facebook. She's also, of course, ensuring that this platform is very stable. And in addition, we've got we will be opening to questions. And so for our audience, we just like you to know that the chat is actually disabled. So we will not be using the chat. But if you look to the bottom of your page, you'll see that there is a Q&A. So that's the icon that you will be using to ask your questions. And I will be opening it up probably about 3 times for questions. And I'll let you know just before I open up for questions. So we won't be streaming it live because we won't catch your questions when we're streaming it throughout the whole hour. So what we'll do is I'll let you know when we'll be opening up the Q&A, and that's when you can click that icon and you can tap any questions you may have that you'd like us to answer. So here we go. Let's start out with the first question, which is how do we predict the legalization of recreational marijuana and how it's going to impact the workplace? And Jason, I'd like it if you could start with that one.
Sure. So I think it's important to start this off by distinguishing between medical and recreational cannabis, because the medical market has existed for over 5 years, and there's around 270,000 patients across Canada, and so that market has kind of been, that is going to be excluded from the rec market. The rec market is going to be about 39% of the Canadian population of adults who have reported through a Deloitte survey that they would intend on becoming recreational cannabis users. So I think we'll distinguish between the two. I think there will certainly be an impact in terms of a lot of work on the front end for employers to prepare policies, to ensure that those are properly communicated and people are receiving the necessary training, and then of course upholding those policies in the workplace. That's one significant impact for the workplaces, as well as the absence of a definitive impairment test for safety-sensitive roles will create, that legalization will create some challenges there for employers. However, I overall see it as kind of a moderate impact as opposed to a drastic impact, because it is worth noting that around 22% of adult Canadians use recreational cannabis today. And so, we are already dealing with this, and there are mechanisms in place to deal with recreational substances such as alcohol. So I think it's a question of getting educated, but I don't see a drastic, change in employee behavior. I think employees are still, respectful of the fact that they need to maintain their jobs and then stay in good standing with their employers for the most part.
Okay, and I think that that's a really good point, Jason, is to make the distinction between the recreational and the medical use of cannabis. So thank you for making that distinction. Paula, I'm sure you do a lot of research and risk management in workplaces. So I'm sure that you've got something that you would like to be able to add to that.
Yeah, definitely. So the first thing is I agree completely with Jason that there will be a moderate impact. And that we do have systems in place to manage a number of things already. So we do have systems in place to manage and safety and impairment from any source, whether it's marijuana, whether it's pharmaceuticals, whether it's alcohol. And we also have rules and policies with respect to managing recreational substances, again, including alcohol. We did some research, though, that did say that there will be an impact, though be it moderate. We found that amongst current users, 68% stated that they would use marijuana more often when it's legalized, so evenings, weekends, that type of thing. Past users, 16% said that they would likely resume, at least to some extent. But interestingly, those who have never tried or never used, only 4% indicated that they were more likely to try as a result of it being legalized. So, even though we would see an increase in usage, it seems to be more from a recreational standpoint from people who have already used in the past or are currently using it, rather than acquiring more net new users. So we thought that was quite interesting.
Well, it is for sure. And Sarah, maybe you can speak to the notion of usage. Why would people actually either go back to using it or continue using it, maybe even more frequently? What's the impact on physiologically?
Well, physiologically, some patients, also when you look at patients' belief systems about why they use marijuana, a lot of people say, especially the patients that we've spoken to in our practice, is it relaxes me. I'm feeling anxious and I need something to help me right away. And there have been situations where patients, for example, they have depression, anxiety, bipolar disorder, and they're really looking for a solution to their problems because their current problems are not treated properly by the medications that they're taking. So they're not on an appropriate medication. And so they tend to self-medicate. And so for these patients, it's really important for them to continue getting evaluated. And we try to do our best. So we do genetic testing to help find the best medication that's likely to work for the patient. And that helps a little bit. And we also do patient education. It's important for patients to know that, it's the components in marijuana are really like a drug. So just as with any drug, there are benefits and there are side effects. And the issue when you're talking about the marijuana plant, it's a plant with many different components to it. It's not a plant extract that has just one component that's concentrated. And so when you're taking a drug that has multiple components, you will get certain side effects that patients will experience. And we have seen some patients with anxiety and depression have their condition exacerbated. As well, with chronic use of marijuana, someone can become dependent on it. So there is something called cannabis use disorder, where patients get used to physiologically the drug that's in their system and can experience withdrawal. So they can experience irritability, headaches, as well as the symptoms of their condition coming back. And so that could be one of the reasons that someone would be tempted to stay on the plant for really long periods of time.
Well, there's a lot that you raised that I would love to dive into. So I'm going to start with the first one of the things that you mentioned, Sarah, and I'd like to sort of the notion that it relaxes me, and it prompts me to ask the question, and maybe I'd like Paula, you to answer this. Is when we think about the legalization of recreational marijuana and potentially some industries or occupations that it may influence more than others, is there merit to looking at it, that it might be, you know, workload based, or it might be industry or geography based in terms of usage, or is that this maybe a little bit cockeyed? Paula?
Well, I mean, we could definitely do that, but I think what I'd like to start with is basically just, you know, hitting head on people using it as a coping mechanism. Because I think this is where workplaces as well as public health can really take a fairly strong stance. You know, people use a number of substances socially, and maybe it does provide you with some temporary relaxation. But any temporary coping strategy is not a coping strategy. I mean, if you're using it to escape from issues, if you're not kind of thinking about your situation in a more productive way, if you're not solving the underlying problem, then you end up with a lot of issues, not only the dependency, but you end up actually ignoring the problems that need to be solved. So that's pretty much across the board. And we do have certain industries where they're high stress, where there's high demand, and in some cases we have seen increased use of, again, temporary coping strategies such as alcohol, as well as hard drugs. So for those industries, I would specifically make sure that the employers there are fairly clear in terms of the education and provide employees with options to any substance in order to deal with their issues, because the underlying problem doesn't change just because one becomes intoxicated at a certain point in time.
Okay, so I'm going to ask one more question. I'm going to be opening it up to the Q&A to ask any questions. So Jillian's going to open up the Q&A, and I'm going to ask one more question, because I really think that there's, I'd like to sort of move into the notion of dependency, and as you said, Sarah, the cannabis use disorder that you were speaking to. So I really would like to sort of move into that area a little bit. But Jason, if you could speak to a little bit about who is most likely to be affected by the coming change of the legalization of recreational cannabis.
That's a good question. I guess are we thinking within the context of the workplace?
Well, for sure. I mean, I sort of want to say HR because that's where the policy is based, and that's where the notion of you know, testing and measuring and determining. So I sort of, that's where I'm sort of moving toward, but maybe you have a different take on that.
Yeah, I think it's, you know, this is a whole new area to become an expert in for health and safety, HR, and employment law. And there's a lot of case law being developed now, but it's not as common as a lot of other common workplace issues. And so a lot of people are having to make kind of educated guesses. They're making decisions that are not perhaps as clear as they are where there's 20 or 30 years of case law to support it with regards to cannabis. So I think, you know, health and safety professionals are dealing with the issue of impairment, which is quite complicated. You know, with this, as I mentioned, the absence of a definitive test such as alcohol to say, you know, yes, this person is impaired, or no, they are not. So that group is, I know, kind of frantically preparing some strategies to manage that. Mm-hmm. And then, of course, HR professionals are dealing with the policy side, and in many organizations, you know, training managers and educating their workforce in terms of, you know, what you can and cannot be doing at work, ensuring that they are prepared with accommodation strategies to accommodate medical cannabis. so that they understand, what can or cannot be accommodated. And then, of course, employment lawyers are I think, getting prepared to start making a lot more money, and they're going to be, getting more calls on this. So I think they're looking to become experts as well in a short period of time, because I know that is that this is probably going to be one of the areas where a lot of in-house legal counsels and HR departments will be looking for that external counsel to ensure that they're getting the best possible advice.
Well, for sure. And what I'd like to mention at this time, Jason, is that MedRelief has been amazing at sponsoring an upcoming event that we've got, which is going to be providing a 3-hour workshop just on this topic. It's just to be really provide some of that education to give more feedback and more information to people who will be dealing with this. So that's going to be coming up in September, on September the 13th. We will be hosting that in Calgary. We will be live streaming that across the country as well, so anybody can come into that workshop. And one of the cool things, a takeaway that's coming out of that one is Jason, as a professional HR expert, developed a policy that has been vetted by a variety of lawyers, and just to really help give people a tool so that they could start putting that draft policy and adapting it into their workplace. So there's some really good tools that'll be coming out of that event coming up on September the 13th. But today we do have a question that has come in, which is, and thank you, Amelia, about should medical and recreational marijuana be treated differently? And so I'm not sure who would like to respond to that one. Should medical and recreational marijuana be treated differently?
I can speak to, sorry, go ahead.
Paula?
Go ahead, please. I'll add my comment after.
Okay.
I can speak to the fact that with recreational usage, patients tend to use strains that are higher in the percentage of THC in the plant, which tends to increase risk for side effects. So for example, there are certain side effects that are dose related, such as problems with, for example, dizziness, confusion, problems with focus, concentration, attention span, motor coordination. They tend to be related to the percentage of THC in the plant. And when it comes to recreational usage, patients tend to use larger than recommended amounts of THC and tend to be more prone to these side effects. There's also issues with dose-related increase in blood pressure and heart rate for patients with pre-existing cardiovascular diseases. So there's an increased risk of stroke and heart attacks for certain patients. With recreational usage also, there's increased risk of psychiatric adverse effects, such as hallucinations, delusions. And so when we're talking about recreational usage, there tends to be higher risk, and there tends to be not enough education for employees in terms of the risks and benefits associated with the use of the marijuana plant. There have been only certain conditions for which there's enough evidence where it has been recommended in physician guidelines to use marijuana, and it tends to be used as a third line or last line treatment. And for those conditions, it tends to be, for example, for chemotherapy-induced nausea and vomiting, for neuropathic pain, so nerve-related pain, or for muscle spasticity related to multiple sclerosis. So for these conditions, there's enough evidence where marijuana tends to be used medicinally in practice as a last line treatment when everything has been tried and the patient is still suffering and they need some help. But for other conditions like anxiety, depression, the evidence tends to be mixed, and it could be related to the strain of marijuana. The evidence is not as clear, and I think if employees were to have increased education that marijuana can be used in certain conditions for treatment-resistant cases, but there's not enough evidence for use in others, and also for them to understand that there are side effects associated with usage. Some of them that I mentioned were the cognitive side effects related to the heart, side effects related to as well, possible exacerbation of their conditions. I think if they were to know that, and they were to know that that components in the marijuana plant can interact with their medications and increase risk of side effects from their medications, they're better able to make a decision in terms of whether or not to choose to smoke marijuana. I think another important thing that I want to mention is for safety sensitive workplace conditions, for example, where employees operate heavy machinery or they're involved in driving. I think employees should be aware that if they were to inhale marijuana, for example, it can still impair their judgment for at least 4 hours after they've inhaled that joint. Or if they've ingested marijuana orally, it can stay in their system for 6 hours after and still affect their judgment and their ability to go about their work. If someone was to ingest marijuana and still experience the euphoria or the sedative effects, there's also at risk of other side effects such as impaired judgment and decision making. And so I think it's important that employees are aware of the risks associated with usage, and right. that if that was available to them, if they were provided with education, you're less likely to see it being used in the workplace in ways that can impair work.
And that certainly seems to be a theme that everybody is speaking to is the education piece for sure. I know, Paula, that you want to comment as well.
Yes, so adding to that point, I mean, I think from a workplace point of view, impairment is a big issue, right? Like, so impairment, if you're in a safety sensitive and sensitive environment, is a big issue, and really quite off the table in those situations for obvious reasons. But even if it's not safety sensitive, impairment does impact judgment, as my colleague just said. It does impact customer service. It does impact colleague interaction. So I think that the issue is around impairment, and the way medical and recreational cannabis needs to be treated is very different. Like, if there is impairment based on a medical necessity, so somebody has a bona fide condition, they're under care of the physician, the condition or the care creates some impairment, then you're triggering accommodation obligations. Now, one of the things is that many forms of marijuana don't cause impairment, medical marijuana in particular, so that might not be an issue. But if that is the case, then it is managed by basically the accommodation policies of the organization. If it's recreational marijuana, then it's the individual's choice. Which means that it's really subject to discipline if somebody actually comes into a workplace impaired for any reason and there is no bona fide medical reason why that exists. So you're compromising the ability to do work, you're compromising others' safety, and really it is up to the organization's own policy and practices how they do it. How they deal with it, whether it's legal or not. Being legal doesn't necessarily mean that it's appropriate to come into the workplace impaired. Just like for years, alcohol has been legal, but coming into the workplace intoxicated is not appropriate.
Right, and for sure, I mean, that certainly does make sense to go back to what the existing policy is within the organization. Sarah mentioned THC, and I know that, Jason, as a producer of cannabis, that you can certainly speak to that. And it's also a question that has been asked of Leslie, where Leslie is saying, I thought the difference between recreational is the higher THC and medical is the cannabidiol.
Cannabidiol.
Cannabidiol. Thank you. So, Jason, can you speak to that, please?
Sure. So that's a common misconception. So if you look at both markets, the products are being produced by about 107 licensed producers, and those are you will see the same products or very similar products in both markets. So there are a number of medical strains that are high THC that would certainly cause impairment. There are medical strains where there's less than 1% THC as well. So I think it's important to kind of remember that there is medical benefit to THC that has been prescribed for over 5 years in that market. So I think that's an important kind of point. So what I recommend to employers in terms of the distinction between the two is not necessarily on the product specific, because it's the same products. It is on the obligations. So specifically, if you think about medical cannabis and you liken it to an opioid, Both of those medications can have a tremendously positive impact on the quality of life of an individual. They can also lead to, impairment and motor vehicle accidents and workplace hazards. So I would say you treat medical cannabis in the workplace the same way you would with any other prescription medication that is causing impairment, where you have a duty to accommodate, but there is that point of undue hardship where you cannot safely accommodate. And so, if there's a pilot whose, physician is saying this person needs to use high THC medical cannabis, multiple times a day, that's not something that an employer would be able to accommodate. So I think you have to look at it case by case with medical cannabis to see if a safe accommodation can occur. With regards to recreational, I would liken it to alcohol, where yes, these are legal substances, alcohol and recreational cannabis, effective October 17th. However, there's no reason for an employer to allow, open alcohol or recreational cannabis in the workplace. And that would be something that should be very clearly laid out in the policy. And so that's kind of the way that I would treat them, very differently. If someone's not a patient, then, I would treat it similar to alcohol. If they are a patient, you've got to accommodate. And the prevailing theme in many policies that I think are effective policies is that employers do not have to accommodate impairment in the workplace. So, right. Both substances will cause impairment, but you do not necessarily have to accommodate that.
And so you had mentioned earlier the lack of a definitive test, and we have a question that came in from Shannon, speaking to the testing specifically, and for the testing for drug-related impairment. And her question is, what symptoms can managers use for an initial diagnosis or to look further into the issue?
So I'll start off, and I mean, one of the most readily available options for employers is a test called the reasonable suspicion test, which is, there's a number of organizations that offer this. J.J. Keller and Associates does it. Cannabis at Work does it as well. And essentially, a manager can get trained on how to identify impairment. And that would not be limited to cannabis. That would be kind of overall impairment, usually from a substance. And so that plus regular drug and alcohol programs that are generally targeting urine, those are the two available tests that are most commonly used. However, there are organizations such as the TTC that has already started to use an oral swab test, which is testing for saliva or THC in saliva. And so if there is ever a roadside test that is, please start to use to detect THC in saliva, those parameters, the percentage of THC, the nanograms of THC, would be something that employers could rely on if and when such a test is kind of decided on in our country. Otherwise, you're probably looking at urine and observational assessments. But the urine, unfortunately, does not indicate impairment because the THC can stay in your system for up to 30 days. So it's going to show that there was the THC, but it doesn't necessarily say that this person was impaired at a specific time.
And is there an amount of time that somebody would be impaired? Like we know, say with alcohol, because it's been around for a while, that after, that people will advise that you can drink, one glass of wine over a certain period of time and the effects then will dissipate, or you can have 2 glasses of wine within 1 hour and then you're considered over the limit to drive. So there's certain parameters, for example. What's the parameters around THC? Because if it's staying in your blood system for 30 days, certainly you're not going to be on a high for 30 days, I wouldn't think. I mean, that's not what I think.
Yeah, you wouldn't be impaired to 30 days after use.
Yeah.
I can, a general, like we've tend to be a bit more conservative, and I can say that inhalation is a shorter impairment window and ingestion is longer. Ingestion can actually be up to 24 hours. I've heard certain studies say up to 36. And inhalation, I've heard anything from 3 to 12. So as an employer, I typically go to, the higher option just to be extra safe. Okay.
I think if I can add to that, so what I've seen some employers do is because the urine, as was said earlier, with the urine test, it can stay in your body for a really long period of time, that it's up to the onus of the employee not to come in having having smoked marijuana or anything, because if there's something that happens in the workplace, if the employee was to show some kind of impairment in judgment, and the urine test was to be done and marijuana was found, or the metabolite of marijuana was found in the urine, then the employee could be wrongfully accused of coming in impaired. And so what the HR team in some of the employee groups that I've seen are doing are they're having a zero tolerance policy, saying to their employees, be careful, it can stay in your system a really long time. So it's best just to not ingest it while you're in the workplace.
Okay, that makes sense. In terms of substance abuse, and you've both sort of, Jason, you just spoke to alcohol and making the analogy or bringing alcohol as an example. What's the difference between marijuana and alcohol, and should the two substances be handled differently within the workplace policy context?
So I'll just comment on one thing: the zero tolerance approach. I would say if anyone is going to take that approach, I would certainly get a risk assessment from a lawyer, because there's a lot of risks involved in trying to implement zero tolerance for a substance that can be used medically. And then of course, obviously knowing what we know, that there's a 30-day lag, that I've definitely heard concerns with from different employment lawyers around risks involved in that. But the major difference between cannabis and alcohol, I think, from a pure employer risk management standpoint, is on the ability to accurately test for impairment where there's a definitive measure, and the ability to understand that, for the ability for the body to have alcohol leave the system much faster. Because then, we get to simply mirror our workplace impairment standards against those that are already existing in the Highway Traffic Act and in other kind of accepted measurements. So to me, that's the biggest risk. Aside from that, they're very, very similar and can be, treated very similarly overall from a recreational standpoint, rec cannabis versus alcohol. But the lack of that clarity with the surrounding impairment is creating a big problem. And then, of course, there's much more education and information available on alcohol, because that's been legal for quite a bit longer. So I think those are the two that stand out for me.
If I can add something to that, whereas there are some situations where patients who are using marijuana medicinally are on high strains with high percentage THC, it tends to be, at least in the medical market, the physician is monitoring the patient. And he usually starts with strains that are very low in percentage THC, and then slowly titrates to a dose where the patient experiences the maximum benefit with less risk of side effects. Whereas in the recreational market, especially in the current illegal recreational market, the percentage of THC has been increasing over the past 20 years to an amount that's not regulated in the current illegal market. And so we see patients are definitely at higher risk of the adverse effects, including, for example, the acute psychosis. In the upcoming legal market, the question will be, will there be, of course, there'll be increased quality control, but I guess it remains to be said whether the percentage of THC will be as regulated as it would be when a physician's monitoring the patient and able to find the percentage THC versus CBD that works well for that patient. And so I definitely think there is more risk in the recreational market than there is in the medicinal market, where the patient is being monitored by the physician.
Thank you, Sarah. And we're going to be opening the Q&A right after this question, which I'd like to speak to, ask you, Paula. I mean, Sarah speaking to risk, and of course you do a lot of work around risk management for sure. So I'd like to open that up to you, but I also want to ask you the question. I know that alcohol is addictive, but what about cannabis? Is there an addictive element to cannabis? So I'm sort of asking you two questions, the risk management question, and then about the addiction of cannabis. Paula?
I think I should let my colleagues spoken about that as well. And there's definitely an opportunity for psychological addiction. And if you have any substance in your body for quite some time, then you can actually get to a point where you feel somewhat dependent on it. I do think that there are many other risks as well. So there is the risk, for younger users in terms of the impact on brain function. There is side effects for certain people with certain genetic disposition in terms of psychosis. I do think that, you know, everything does have its risks as well as its opportunities. And I do think that there is a fair bit of opportunity that employers should take as well as public health in terms of educating individuals more broadly on the risks, just so, you know, people are actually making decisions that are wise and well informed.
Okay. So thank you. Sorry, I'm just writing.
I could add a little bit to that as well. So there's the addiction rate for cannabis is around 10%. It's depending on the study, 9, 10, or 11%. So definitely there is an addiction rate. It is less than alcohol and opioids, but it definitely is there. And one of the common misconceptions among longtime cannabis users is that, you know, and I heard this my whole adolescencehood growing up, is people say it's not addictive, but that 10% addiction rate, when you multiply that by, you know, 40% approximately of the Canadian population that has reported intends on becoming a user, that will result in more people dealing with cannabis related addiction for sure.
Okay. Thank you for that. I'd like to there's a couple of questions that have come in that I would like to respond to. Somebody is asking if an email will be sent to this broadcast sharing this recording. We are recording it, right, Jillian? Yep. So we're recording it. So we certainly will be sending that to you after this. So that'll be coming your way. And then from Richard, we have a question that says, since like any self-medication, marijuana is experienced differently biochemically by individuals in its onset, intensity, and duration, especially for new users, what personalizing education will be available to employees to adjust their THC dosage and job performance risk? That's quite a loaded question for sure.
Do you mind repeating? Sorry, can you mind repeating that?
Sure. How would I do that, Jillian? Look under answers. So Jillian took that question away once I read it. so I got it back. Since like any self-medication, marijuana is experienced differently biochemically by individuals at its onset, intensity, and duration, which especially for new users. What personalizing education will be available to employees to adjust their THC job performance risk?
So I just want to comment on the term self-medication. So medical cannabis is a medication that is authorized by physicians and nurse practitioners. So
right.
Many of whom have received training in this area. And so it's, you know, there'll be specific products. There's a lot of information on licensed producers' websites specifically saying the CBD and THC percentage. As well, you know, many of the licensed producers have nurses available for consultations. And so I would say that there's a lot of information available on the products. There's also personalized genetic tests that exist where a patient will be swabbed and a sample will be sent into, you know, a hospital, and it will actually come back with recommendations in terms of how this person will be able to how they will metabolize the products. And so that can help ensure that someone is receiving the proper dose, and as well as actually strain-specific recommendations. So those products exist today on the medical side. On the recreational side, of course, because it is, you know, it was mentioned earlier, there's not physicians involved in that. And so that's where, you know, people will be, you know, experimenting with certainly there'll be product information available, but it would not be under the kind of guidance of a medical professional.
For sure. And I totally understand the distinction you're making there. And thank you for that, Jason. It leads me sort of to you, Sarah, a little bit, because there's the whole notion of genetic testing. And so why don't you speak to us a little bit, because that's really where you specialize, is the genetic testing. Could you want to speak to that a little bit?
Sure. There are a lot of companies in terms of who are currently looking at the genes involved in response to strains, specifically in terms of THC and CBD. So differential response to strains that are high in THC versus strains that are high in CBD. However, this genetic testing information is very new evidence. It's not well developed in the field of science, so it's currently in development. So it's too early for us to actually test somebody and be able to say, hey, this is how much THC versus CBD you should use. It would be based on weak evidence. The genes that currently do have some evidence are the genes linked to adverse cognitive side effects on THC, so problems with memory and concentration. Certain patients are more at risk of that than others, as well as risk of impaired decision-making on THC strains. So a lot of the studies are in THC and not so much on CBD. There are some companies out there that are currently trying to tailor it based on different cannabinoid receptors in the brain, but the science is still developing. It's more of experimental right now. And right now, there are a lot of researchers that are competing to try to figure out which receptors are more indicative versus others, but we currently don't use it to make recommendations to patients in practice, at least in our practice, because we believe the science is still developing and there's not enough information to make a recommendation at this time.
Okay. So moving on with that, I'm sort of now thinking and around the notion of the benefits package, and I'm thinking, you know, right at this point, I don't believe that medical marijuana is being included in benefits packages, at least not in a significant way at this time. What are some of the pros and cons of including medical marijuana in the benefits package? And Paula, I'd like to start with you on that one.
Right. So a couple of things. It's not common to have medical marijuana covered in the benefits package at this point in time. However, there are some benefit packages that do include it. So it's not sort of net new, and medical marijuana has been around for a long time. So those changes have actually started to happen. So typically what the process is that when there's any kind of substance, there's some review in terms of its efficacy, there's some review in terms of the specific indication, just to make sure that it's worthwhile, and that there's decisions made, again, primarily by insurers about whether to include it in the standard formulary or an optional formulary. So I see the same process happening, and with more education, with more research, and quite frankly, with more interest in the area of marijuana overall, there's likely to be more plans that include it, but there are a few that currently do already.
Okay, Jason?
Yes, I'd say it's not a common benefit yet, but I think as what I've learned over the last couple of years since I've been at MedRelief is, you know, there are more and more employers adding this coverage every day, and you know, there's some large employers. I mean, there's obviously like OPSU, Liuna, Shoppers, Loblaw, you know, Aurora, my organization. Like these different groups have started adding it. And I think we're the first wave, and then the Sun Life product that became available earlier this year made it, I think, brought an element of comfort for a lot of employers, because obviously Sun Life is a tremendous organization, and I think they've structured a plan that makes a lot of sense. And so I know that people have been adding it more and more frequently. And so I suspect in a few years it'll be fairly common to see that. But in terms of the pros and cons, I would say the con that I've heard from some very wise benefits specialists who work for Cubic is that because the cost of cannabis generally is a bit higher than traditional pharmaceutical medications, employers adding this coverage would likely see an increase in cost. Like it's not going to have a cost offset, which obviously would be great if that was something we could confirm, but it does look like it would be just a net added cost. And then obviously a lack of data on usage rates, and you know, it makes it a bit of an unknown. I think the major pros would be obviously any opioid alternative. I think is important for employers to consider, and employees who are medical cannabis patients, you know, or any medical cannabis patients can be spending up to $14,000 a year on their medication. And so I think the major pro is going to just be anytime an employer can offer something that will help their employees access the care or medications that help improve the quality of their lives. I think that's the most significant pro.
Okay, and so just to be clear, so Diana is asking a question. So if it is added into a benefit, it would be entirely separate, not just included in prescriptions. Is this correct? So she's asking if it's going to be separated from, so it's not going to be treated the same way a prescription medication is. Jason,
actually, it would be. If it is in a benefit plan, then it would be managed in the same way that benefit plan works. So however any other medications are managed through the benefit plan, if there's a prescription required, there's also a requirement to make sure that it's covered under the formulary. The reimbursement, whether the employee pays or whether it's paid directly, there would be no real difference that I could see. So, unless I'm not understanding the question, I just want to make sure that, it isn't like employers would be setting up separate benefit plans for medical marijuana. It would be included in the current benefit plan.
Right. And I certainly thought that as well. And Diana, that's a really good question, just to be clear. And I think that for me, and I think that probably for everybody, that there's the idea that marijuana, for so long, we've known marijuana to be illegal. And so now we're bringing something that was illegal into a legal context. And so there still is that perception that it has to be handled differently or worked with differently. And there is that sort of stigma that's still attached to that word marijuana. So to start, should we really be looking at maybe calling it cannabis instead? Does that help us with this sort of stigma or this preconceived notion that we shouldn't be really, talking marijuana? Jason?
I would definitely be, I would recommend to anyone that cannabis is the appropriate term. And there's plenty of kind of easily searchable explanations, but I think the number one is that it is there are unpleasant racially insensitive connotations with the word marijuana. So cannabis is the appropriate term, and some communities have gone so far as to outlaw the word marijuana, believe it or not. So that's definitely the right word. The big element on benefits plans is that cannabis is not a drug in the sense that it doesn't have a drug identification number. So that question also may have been asking, is this something that you would just add to your list of approved medications? And the answer is some have done it, and they give it a product identification number to apply the same coverage percentages that they would for other medications, but that's very rare. What's most common is to establish it as an extended health benefit where there's that annual allowance, which is what the Sun Life program is.
And that's a brilliant answer because Jake did ask that question specifically about the fact that medical cannabis doesn't have the DIN or the drug identification number. So I think that really speaks to that one quite well. So I have sorry, I have another question here. There is a scenario that was raised by, and again, I'd like to, any other questions that people would like to ask, we're opening it up one more time to ask your questions. I think that we only have one more left at this right now, and Jim actually has asked this question, and I have it as a typical scenario as well. So I'm going to ask Jim's question. So Jim is saying he's curious to know what employers are planning for the use of recreational cannabis at corporate social events. For example, the annual Christmas party. And this is a question really that goes to corporate culture as well, because what we see is there's a lot of corporate cultures where they go out for a drink, they have a drink at lunch, or they with coworkers, or at the end of the day, folks go out for a drink, and that's all fine. How are employers, or how should we be handling this whole notion of having sort of, cannabis at corporate social events? Who would like to start in on that one? Paula?
Yeah, I can comment because this has been an issue that's been circling around, as you can imagine, for a little bit. And again, I think you're absolutely correct in terms of putting it into the bucket of corporate culture, because what people allow, what the norms are, what the expectations are really do define the corporate culture. So first of all, just to extend the analogy from alcohol, there are some cultures who don't allow alcohol at corporate events for various reasons, for some people who have dependencies, for safety reasons, drinking and driving, for financial reasons. There's a number of reasons why in some organizations alcohol is not part of corporate events. We have had a couple of organizations actually specifically come out with policy in anticipation of the legalization, saying that although they do allow for alcohol at their corporate events, they will not allow for cannabis products at corporate events, whether ingested or smoked or any kind of recreational use of marijuana. And that is their choice. It's basically a policy decision in terms of what the organization chooses as part of what they support or don't support. Most of them remain silent right now and are kind of taking a wait and see attitude in terms of what comes as the norm. So it'll be a question that I think we'll have to ask again over the next little while.
For sure. I mean, I think, you can go to events and you have the alcoholic punch and you have the non-alcoholic punch. And it becomes a choice as to which one you will drink, whether you'll be driving or not. So you self-monitor, but there are those choices. And it sort of reminds me of, having the regular brownies and the, marijuana brownies and people being able to make a choice because it's legal and you're allowed to do that. I mean, so, so you're saying it's a policy choice, but I'm looking at it and saying, should they not just allow people to self-monitor which brownies they choose to eat, just like they monitor which punch they choose to drink?
I think
Paula, go ahead. Paula?
And I think for organizations who do sort of allow and offer it as part of the workplace, it'll definitely be left to individual choice. Mm-hmm. I think what employers are still wondering is whether they would even have that option available, or whether they just wouldn't have cannabis-related products available at corporate or social events. So that's the decision point that's being made right now. Yeah.
Okay. Sarah?
I was going to make the distinction between also the route of ingestion. So for example, smoking cannabis or vaporizing cannabis versus ingesting cannabis, there are the same risks in terms of smoking cannabis that are very similar to smoking tobacco. They both result in the making of toxic combustion products that can irritate the lungs. And so there are the same risks related to secondhand smoke as with smoking tobacco. So I don't imagine that this route of ingestion would be allowed in a lot of corporate environments just because of the same risks being involved.
Yeah.
But I imagine there will be some differences between different employee groups in terms of whether ingesting cannabis orally will be allowed or not at workplace events.
Okay. Jason, did you have anything you'd like to add?
Well, hopefully a lot of employers will be able to rely on the applicable laws around cannabis use in their respective province, and then obviously bylaws around smoking and vaporizing, where they can avoid having to be making these decisions kind of exclusively taking full responsibility. And hopefully there will be some clarity coming from provincial and then the municipal bylaws. But my position on this has always been if there's I think about Toronto, a lot of holiday parties, you'd rent out a restaurant, and if you're legally permitted to use cannabis on a street,
yeah,
that is where you would have your people who smoke cigarettes would go, and you're not breaking the law by doing it, and there's no reason why you legally can't do it. I don't think it will be easy for employers to try to say you can drink and we'll pay for your taxis home, but we draw the line at cannabis use when the actual criminal code would allow you to do that outside. And then you come back in and you're going to have your people who are, high from cannabis, and then they'll be sitting next to people who are drunk from alcohol. So I think that it's going to be hard for people to say you can't do one, but you can do the other. So
Sure.
I think hopefully there's some clarity with the legislation, but if not, I really don't, I think that will be drawing that type of arbitrary line, I think would be difficult to enforce.
Yeah, and I agree as well. I think that it would be really tricky to do that, and I think that this conversation is one that is going to be going being more and more frequently as we approach the October deadline and for legalization, and also why we're having an actual workshop in September on the 13th of September. It's going to be live in Calgary, and we're going to be doing live stream across the country for this one. It's going to be more of a 3-hour workshop talking about a lot of these different issues, and actually giving people policy statements and educational tools that they can walk away with to be able to use in their workplace. So we're pretty excited about continuing on this conversation moving forward. Because there's a lot that I think that we need to do to prepare our workplaces. I don't think it's I think it's very much along the lines of alcohol and having policy statements that are going to be certainly part of the policy as alcohol is, but I think it's more about education as well, and just having conversation, I think really is probably the place that we need to start. And Jason, you had mentioned educational tools, as you did, Paula and Sarah, actually you all did. What kinds of, when you're speaking about educational tools, what are you specifically thinking about? Are you just thinking about hosting conversations? Are you talking about handouts? What specifically are you referencing when you speak about educational tools or educating? Sarah?
I would say the most effective form of education is when employees are directly involved in the education process. So an interactive education where, for example, there's a workshop or the employees are allowed to ask questions, that tends to be more effective than just providing a brochure, which some employees may or may not read. I think I would probably go that route, have an expert who is well versed in the benefits and side effects of marijuana usage, a consultant come in and speak to employees about some of the risks and benefits associated with marijuana usage, giving a good overall picture. We have had situations where we've spoken to certain employee groups and it has been no amount of marijuana will be tolerated, and I find that's not as effective as giving a more balanced view of
Sure.
Because there will be some patients who are on it for medicinal reasons. So I think that would probably be the most effective way, in my opinion, to go about it.
Thank you. Paula?
Yeah, and the one thing that I would add to that is that organizations currently have challenges, and they also have channels for communication of a health and safety nature. So likely they would use them. So it does include kind of static information, but also does include workshops, webinars, interactive forums. And I would encourage all organizations to sort of look at, the cannabis issue and incorporate that into their agenda. The one point that I would call out as well is an important part of any kind of workplace health and safety education involves educating managers as well. So their role, if there's questions from employees, if there's policy, understanding the policy, if there's no policy, understanding the guidelines, if there is any kind of suspicion in terms of impairment or any kind of question that might come up as part of a work team with an individual employee or the manager themselves. Typically, employers have invested and should invest in additional training and development for managers. So I wouldn't want to kind of just have them blended into the larger fold, but have more attention to the management group as well.
Absolutely. I mean, for sure, that makes a lot of sense because they are the first line in terms of knowing, not first line, but they have their whole team, and they can be handling these things for absolutely. Jason, is there anything else? We're running down to the last minute before we have to be finished. If there's any other questions, please, folks, put that in right now. Jason, how about you end on the education question?
So there's there's been a few good sources, good webinars. There's been a number of events across Canada focused on employer education. So I think, definitely proactively investing in some of those sessions is important, and also having a couple of people in the organization who are maybe tasked with reviewing on a weekly basis, what has changed with the legislation, because the industry does move so quickly. Having some people who maybe are responsible for advising the rest of the management team or the rest of the HR team on what new developments are there, and ensuring that people are kept current, because it is a moving target in a lot of ways. So I think that's another important element of the education piece. Is it doesn't end at just attending an event. It's kind of one of those ongoing dialogues that someone will have to own for the next couple of years.
Yeah, I agree with you there. And I think too is that the education is just starting to those pieces are just starting to be developed right now. And again, why we're looking at having that webinar is between now and September, we're compiling all kinds of resources from experts that people could use immediately in their workplace and in the next few years to stay on top of this. So for certain, there's quite a bit of work that we have to look at doing there, and we've taken that on here at your workplace as well, to be able to provide that to our communities, to certainly stay on top of this topic and continue on the conversation and continue on with the education process. So those kinds of tools we're developing now, and we will be releasing that when we have our regional event on September the 13th. So I'd like to thank you all for being here today. It was a wonderfully robust conversation, hit lots of things, and boy, oh boy, I've got a paper full of all kinds of notes of questions that I'd love to ask, but we are, we can have this conversation for a very long time. So I thank you very much for participating today, to our audience for being there. Sarah, Jason, Paula, thank you very much for being involved.
Thank you for inviting me.
You're
welcome.
Thank you. Okay, bye-bye.